Around the world, lockdowns are easing, and a new approach is taking center stage.
Tracing and quarantining every contact.
We will have a test, track and trace operation that will be world-beating.
We need that tool so we can open up the economy.
But can track and trace deliver, and can we trust it? Time and again in March we heard about flattening the curve, and in most countries it's happened. These are infection rates in the UK, Italy and France. And because of graphs like these, lockdowns are being eased. But now attention's turning to controlling new outbreaks. The WHO is clear. When systematically applied, contact tracing will break the chains of transmission of an infectious disease and thus is an essential public health tool. So what is contact tracing? Well, this is about countries knowing who has the virus and who they've been in contact with. But it comes in many forms. Some systems are digital, some manual, some both, some are voluntary, like in Australia, Germany and Singapore. Some, such as China and South Korea, are definitely not. And however you do this, there are major challenges. One of the reasons is personal data. Phones are being used to monitor proximity to other people and location, and the data is not always anonymized. China and South Korea monitor the location of people who have the virus and their payment history, and they don't ask permission. And both have largely tracked the virus effectively. But in South Korea at least, there's awareness this approach is unusual.
확보할 수 있단 말이죠. 이거 사실은 아주 무서운 현실입니다. 그러나 감염병 사태가 아니라면 절대 그래서는 안 되지만.
Scary is the word for many people, unacceptably scary, whatever the public health benefits. Amnesty International has warned Bahrain, Kuwait and Norway's contact tracing apps are highly invasive surveillance tools. Well, now Norway's suspended its app and Germany's been mindful of these concerns. Its app doesn't log your location, but there's an acknowledged tension here between protecting people's privacy and how well the virus is tracked. And then there's the challenge of getting people to sign up. The more people, the more effective the system. But if you're a democracy, getting most people to take part is hard. Singapore wanted 3/4 of people to have its app. It got 1/3 and not all of them are using it. One senior official says there's a trust issue. Australia's target was 40%. So far it's reached 25%. Though its success containing COVID-19 does mean it has less need for the app. The remaining challenge is that you need an app that works. In Moscow, a quarantine tracking app has been fining people for being outside when they weren't. Australia's app has struggled to get Bluetooth connections with all contacts nearby. And then there's England. In May, the government said people had a duty to download its app and that it would launch after a trial. Now, though, we're told this.
We're seeking to get something going for the winter, but it isn't the priority for us at the moment.
And the UK government announced it's scrapping its first plan in favour of a version which collects less data. And its reasoning offers an insight into the issues around digital tracking.
And in fact, there is a danger of being too technological and relying too much on text and emails and alienating or freaking out people.
Which leads us to manual track and trace. In other words, tracking done by people. We know from Ebola, smallpox and HIV, this can be highly effective, arguably the most effective measure. But among the world's most affected countries during this pandemic, while America and Brazil's manual tracking is piecemeal, and in England's case, remember Boris Johnson's promise? Well, here's the New York Times. England's world-beating system to track the virus is anything but. And we know in its first week, this system referred over 8,000 people with COVID-19, over 5,000 of them handed over their contacts, and around 30,000 of those contacts agreed to self-isolate. It's a start, but like in many countries with high case numbers, it's far from comprehensive. Contact tracing is billed as the bridge between now and a vaccine. For all the reasons discussed, we're still in the early stages of building it. Thanks very much for watching. If you liked that report, you can find lots more from me right here.